Now that we know a little bit about the background and opportunities for Poway ER and the case management department, I'd like to define some common words used throughout the rest of my presentation. Hospital discharge describes the point at which inpatient hospital care ends and with ongoing care transferred to other primary, community, or domestic environments. Reflecting this, hospital discharge may not be an end point, but rather one of the multiple transitions within a patient's care journey. The organization and provisions of this transitional care typically involve multiple health and social care actors who need to coordinate their specific special activities so that patients receive integrated and safe care. Then the inherent complexity of coordinating a large number of actors, often based in distinctive organizations, leads to the view that hospital discharges can be a vulnerable, time-dependent, and high-risk episode in a patient's pathway. In 2010, the Department of Health published a new discharge workbook, Ready to Go, Planning the Discharge and Transfer of a Patient from the Hospital and Intermediate Care. This outlined 10 steps to ensuring a timely, safe, and patient-centered transition from the hospital. Some of these included effective communication, alignment of services, effective system and processes to support discharge and care transfer, clear clinical discharge management plans, early identification, organizational review and audits, and 7-day-a-week planning proactive discharge planning. Another term used throughout this is readmission. A readmission occurs when a patient is discharged from the hospital and then admitted back to the hospital within 30 days. A high rate of patient readmissions may indicate inadequate quality of care in the hospital and/or a lack of appropriate post-discharge planning and care coordination.